Happy Veda! It's day 21, and I'm coming to you with my pump strapped on. I'm pumping. Sorry about that noise. Can't help it. So today's video is going to be about me being frustrated with my weight loss surgery place. You guys know that my 3-year surgery anniversary is coming up. It will be April the 26th on a Sunday. My 3-year surgery anniversary appointment was scheduled for May the 1st. Last week or the week before, I don't remember if it's been 1 or 2 weeks ago, I called the surgeon's office and left a message with Miss Bobby Woodard and for the insurance and basically said, call me back, insurance question. I need to know exactly how much my visit's going to cost. I have insurance, but it's that we've changed. And I need to know with my current insurance how much the visit's going to cost. I've been toying back and forth about not going. If the visit's $100, $150, we'll go. If that visit's like $500, I'm probably not going to go. I didn't say any of that on the message. It's been at least 1 or 2 weeks, because I can't remember if it was last week or the week before that I called. I think it was last week, so it's been a week. Nobody's called me back. I also have myhealth@vanderbilt.com, which is where you can email the nurses and ask them questions. And I've always gotten a response from them within like less than 24 hours. I mean, it says give them up to 72, I think. So a couple days after I had emailed or called Vanderbilt, I then emailed Vanderbilt. And I know it was a nurse hotline, and I said, I know this is the nurse hotline. This is what I need. Could you please give me the information of who I need to talk to? But in the email I sent to them, I gave them my name, my subscriber ID for my insurance, told them what kind of insurance I had, and just said, I need to know how much my visit on May 1st is going to cost. Today, I received a phone call, and it was from a Nashville number, and I got so excited. I was like, yes, they're calling me back. And they were calling me back. They weren't calling me back. They were calling me to change my appointment. And I know this is like the 4th time they've changed my appointment. And I know that when you make those appointments a year ahead of schedule, I understand having to change. I know they never know what's going to come up. 4th time. 4th time. And once or twice when they called to change, they were changing the time, not even the day, just the time, or they'd changed who my appointment was with because they had something else going on. Well, now all the doctors and the nurse practitioners are all going to be out of the office for some kind of convention, and I need to change my appointment. Fine, no big deal. I understand. And then I asked the lady on the phone, I said, look, I just called Vanderbilt last week. I had these questions. I left a voicemail with Miss Bobby Woodard. Could you please tell me, I know you are I know that you're the receptionist and you make appointments, but I need to know who it is I need to talk to specifically. Could you guide me? She said, oh, sure, no trouble. Let me go look on your file and see who your insurance claim lady is. And I said, great. Turns out it's Miss Bobby. So she directs me again to Miss Bobby's, or directs me to Miss Bobby's voicemail, and I leave another message where I said, this is Sarah Robinson again, blah, 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 blah. Please call me back. Went through the whole spiel. Still nothing. I've got the rest of this week to see. And I don't know if it's because I'm not, I'm a patient of theirs, but I'm currently not one that's going to be spending a lot of money there. If that's why I'm getting the runaround, or this is a basic question. This shouldn't be that hard for anybody to answer. I know people are on vacation and people are out, but that lady didn't say any of that to me. She acted like it was no big deal when I talked to her on the phone. And so, anyways, I'm a patient person, and it takes a lot to make me angry, but I just cannot stand to get the runaround about the crap. And I'm not even getting the runaround. They're just not responding to me. So I'm guessing it's just because I'm not a money maker anymore for them. But you know, I do have this vlog that I do, and I honestly, I've had people talk to me about my surgery before, and I got to be honest, I didn't recommend Vanderbilt. I recommended Centennial, which is who my first option would have been to go with, but I couldn't get, my insurance wouldn't cover Centennial Hospital. Vanderbilt needed to do a lot of work with their patients post-op. So every time I'd go, nobody could believe that I was doing what I was supposed to be doing, and that I was having the success I was supposed to be having. I know from watching these videos and everything I read and just being in contact with so many people that I've been a success. I'm not trying to say I'm not. There have been people who are way more successful than I ever even dreamed about being. I'm not acting like I'm not pleased with my success, but they just couldn't believe I had the knowledge and knew the things I knew. And I did my research. And if I hadn't have done that and I'd have gone to Vanderbilt, I'd have been in huge trouble. So that has been a suggestion of mine, that they really, really, really work on that area. I think they're leaving their patients hanging. I think they're missing out. I think there's a huge opportunity there to educate. And maybe had I lived in Nashville, because I'm 3.5 hours away, the education portion would have been easier for me. There would have been more available to me. And I just didn't know that there was more available because that wasn't an option for me. Maybe that's the deal. I don't know. Anyways. Okay. See you tomorrow. Bye.